Hello guys, in this video we are going to see the disease of the middle ear. Especially we are going to see the acute conditions like acute suppurative otitis media, and then we are going to see the serous otitis media or glue ear. Okay, first this acute suppurative otitis media means an acute infection. Especially this suppurative word should be used only when there is a production of pus. In other times where is no pus, it should be called as acute otitis media. The causative organism most commonly is Streptococcus pneumoniae. You can remember the mnemonic as MOPS in Streptococcus pneumoniae, where the O stands for otitis media. Then other organisms like Haemophilus influenza, then Moraxella also causes this acute otitis media. You can need to know how the infection spreads. Usually this bacteria comes from the nose and pharynx and then through the eustachian tube. From there it causes the infection to the middle ear. It is most commonly seen in children due to the presence of small eustachian tube or horizontal eustachian tube. Okay, this acute suppurative otitis media occurs in 4 stages. First, the stage 1 is the stage of tubal occlusion. This happens when the nasopharyngeal end of the eustachian tube is blocked. That is the tube towards the nasopharynx. Due to this blockage, there will be negative pressure in the middle ear. This causes retraction or pulling of the tympanic membrane. Thus, when you see from outside, you can see that the tympanic membrane is retracted. This causes pain, and there will be decrease in hearing due to this retracted tympanic membrane. Okay guys, then it will be very edematous, ocular, then no cone of light will be seen. This is a very important part. Then the second stage is the stage of pre-suppuration. That is stage before the suppuration or pus production. There will be sterile serous or mucoid secretion. Normally this middle ear there is content of mucous epithelium, so there will be secretion of mucoid epithelium, mucoid secretion. Guys, in this stage there will be presence of cartwheel appearance. This is the blood vessels become prominent. You can see this is the cartwheel appearance. In this stage also there will be increased pain and hearing loss, and this stage will convert into stage of suppuration, where this here the production is mucoid, but here the production is pus. There will be severe pain. There will be tragus and produces. That is when you apply pressure on the outside tragus, it will cause severe pain. Okay guys, the tympanic membrane become red, congested and bulging tympanic. We can see it is very ready to burst due to the production of pus, due to the pus inside the middle ear. Then the stage of resolution. Usually this heals by itself. When the tympanic membrane bursts, it produces a perforation. Pus comes out and then the pain decreases. The most common site is the anterior inferior quadrant. That is the this is divided into 4 quadrant. This is anterior, this is in posterior, and the most common in the anterior inferior quadrant. You can see this anterior inferior quadrant. It is the most dependent part of the tympanic membrane. Okay guys, after a few weeks the perforation heals within 3 to 6 weeks and hearing becomes normal. A healed tympanic membrane is dimeric. That is that in the perforation area there will be no fibrous layer, so this is dimeric. You can see the lighthouse sign. That is when the pus is coming out constantly. When you give a light, light is reflected back. Okay guys, then what is the treatment is for stage 1 and stage 2 there will be you treat the microorganism causing it. You need to give antibiotics, analgesics for the pain, and nasal decongestion drops to relieve the block or condition. Then you need on the stage, that is the stage of suppuration, you need to do meringotomy performed to drain the pus. It is performed in post inferior quadrant, so that easily the pus can drain out easy further, and also it has the more capacity to grow again. Rate of growth is posterior superior goes first, then posterior inferior, then anterior inferior, then anterior superior. But if you put incision on posterior and superior, it the pus can't drain through as it is present in the above region. Okay, yes. Then the stage 4, you should not do anything, you should leave, and the tympanic membrane will heal itself, guys. Then the complications are the most important part of the acute suppurative otitis media, because the most common complication is acute mastoiditis. The infection of the middle layer spreads to the mastoid. It is the most common complication. Sometimes this perforation heals, but in some cases it does not heal and produces chronic perforation. That is one of the complication. Another complication is acute mastoiditis. In acute mastoiditis there will be sign and tenderness over the Simba Gonka under the mastoid region. There are 4 important signs will be seen here. First, it will be the ironed out mastoids. You can see they become a red hot and it become ironed out mastoids. Then you can see the battle sign or battle sign. You can see the hematoma over mastoid due to the rupture of middle cranial fossa. This is known as the you can see hematoma. It is a pink purplish color. Then you can see the grayness sign. It is a pitting edema over mastoid due to the sigmoid chain thrombosis. That is it connected to the emissary vein. You can remember this as extramarital emissary vein affair with girl singer Grisinger sign. Okay, guys. Then other sign is the reservation. If fluid was cleaned, it will be still coming out. It is also seen in acute mastoiditis. The treatment is the you should give the IV antibiotics for 7 days to remove the infection. Okay, guys. Then you can perform surgical methods like mastoidectomy if the antibiotics there is no surgery required. This antibiotics can cure the infection and this mastoid tenderness will become normal. Then another complication is the collagen mastoiditis. It is a chronic complication of ASM. This condition is middle inflammation resolved, but the infection is occurring in the mastoid hair cells. There will be fluid present in there. In this condition, the treatment is IV antibiotics for 3 weeks. You need to go, and then if it does not resolve, you should do the surgery. You should do a simple mastoidectomy, cortical mastoidectomy. And then another acute condition is the glue or serous otitis media or secretory otitis media. In this condition, there will be no inflammation or infection. The only cause is due to the excess production of the serous fluid from the middle ear. Long-standing collection of serous or mucoid fluid in the middle ear. It is also known as mucoid otitis media, secretory otitis media, non-suppurative otitis media, or glue ear. It may be due to the tumor or from the adenoid infection. It may spread to the tube and it causes tubal occlusion, where it causes no way for the drainage of the fluid in the middle ear. In this condition, normally there will be no pain, but there will be decrease in hearing. That is most commonly conductive hearing loss due to the presence of the fluid. There will be fluid in the middle ear basin. It causes bulging of the tympanic membrane with fluid behind. The fluid will be most commonly venous blood, so it is present as a bluish in color. This bluish tympanic membrane. Okay, guys, this is known as Lawyer's sign, guys. I don't know the pronunciation. It's known as Lafayette sign, I think. It is the Lafayette sign is also seen in glue ear. It's in glue ear. Other conditions like accumulation of blood inside the middle ear membrane, and in cholesterol granuloma also this Lafayette sign is seen. Okay, guys. Then when you do this pure tone audiometry, which is the hearing tests, you can find a AB gap of 20 to 25 to 35 dB. Okay, guys. Then in the tympanotomy, it shows a B curve. We can discuss the tympanotomy later. Then the management, guys, you should treat the primary cause like a tumor or adenoids. Then you should do the myringotomy. Normally this is myringotomy normally means when you operate with the tympanic membrane, but if the tympanoplasty means you should operate with this tympanic membrane and also the ossicles present in the middle ear. So here myringotomy should be done and then drain the fluid. This most commonly the incision is made in the anterior inferior quadrant. Along with this grommet, this is the grommet, it should be inserted into the tympanic membrane, so that the whenever the fluid production is there, it drains outside. Okay guys, and this after few months this it comes out on its own. And also treating this glue here, there is another principle is known as Beer-Can principle, where you should make two incisions, one in the anterosuperior quadrant for air entry, and another in the antero-inferior quadrant for pus drainage, guys. Okay, thanks for the video.